I have here an unfortunate individual who's grown a lump which is shiny, and it's at the junction of where the nose meets the eyelid. Part of it is probably difficult to see in this video, but part of it is on this portion of the eyelid that I'm pointing to. This is probably a basal cell skin cancer called a basal cell carcinoma. What I want to do today is to take out an area that's probably about the diameter of this Q-tip right here, and the diameter is just enough to make a diagnosis, or should be enough to make a diagnosis. We have to numb the area first. We have to put a stitch in, and after a period of 2 or 3 days, or maybe longer depending, we'll take the stitch out. Then what happens is we get a laboratory report. It takes usually about 7 days ordinarily to get the laboratory report back. If it proves to be a skin cancer, then she needs to have eye plastic surgery and probably also Mohs surgery. Eye plastic surgery is necessary because there's a tear duct below here. There's a lot of little muscles that control your eyelid, and if any one of those are cut to any great extent, then you begin to lose either the control of your eyelid or you get a stopped up tear duct, which means your eyes water all the time. This is in part done by Mohs surgery because it's a microsurgery where they take out a small area at a time, look at it after freezing it under the microscope, and decide whether all the cancer's gone. Once the Mohs surgery, that's M-O-H'-S, it's named after Dr. Moh, so it's his original surgery called Mohs surgery. After the Mohs surgery is done, then the wound would be treated by the eye plastic surgeon because it has to be repaired, it has to be closed up, and it has to be closed up in a way, again, so that don't affect these small eyelid muscles or mess up the tear duct that runs from the eyelid to the nose. Sort of complicated. I was just asked before we started the video, well, how many visits does this mean? Probably 6, because you got to go to the eye plastic surgeon to talk about it. You got to go to the Mohs surgeon, then you got to have the Mohs surgery done, then back to the eye plastic surgeon, and then of course the stitches. I guess that's 6. Dermatologists can't count.